Good morning, everyone. I just wanted to say good morning. This is Patty Owens. While we're waiting for Jason to join.
Sorry about that. Yeah, thanks.
There's Jason.
I was on double mute. I was talking for like 10 minutes and nobody heard me. Anyways, thank you guys and welcome to the COVID Weekly Roundup. My name is Jason Bell and I'm the Director of Emergency Preparedness and Physical Plant Services with CAF. Today, our guest speakers are Patty Owens, who you just heard. Thank you, Patty, the Director of Regulatory Affairs for CAF, and Deanne Walters, the Director of Clinical Affairs and Quality Improvement. I think we've got to work on Patty lengthening her title so that so that it incorporates all the stuff she does. As always, we maintain a coronavirus resource section on our website that can be found at that link there. We will be creating a new a portion of that website that's going to just talk about vaccine information. And we realize there's a ton of information that has come out, some of it very last minute, big systemic changes in how vaccines going to get to portions of California. So we're going to cover a bunch of that. And I want to let folks know that we are going to attempt to end this either a few minutes early, but definitely not late. So there is a webinar at 2 o'clock and there's a link in these slides that I'm going to point you to. Hopefully you saw the link in the CAF forum for the webinar for LA County, but I'm going to show you where that is, and it's at 2 o'clock today, and everybody in Los Angeles County should be on that webinar. So very, very important, and I'll cover that in a second here. So, all right. So as an introduction to the webinar, the speaker's opinions expressed are their own, may not reflect CAF's official position. These webinars are brought to you from a grant-funded program through the Hospital Preparedness Program. CDPH facilitates that grant. I have no financial conflicts, and nor do Patty and Deanne. The intent of the webinars is to give you a situational report for what's happening with the coronavirus response, provide a little forecasting and best practices where we can identify those. All right, so let's get to the first AFL. I'd originally put AFL because there was only one, but then another one came out this morning, and we'll cover that a little bit in a second here. So under AFL 20-48.2, this talks about transfers to alternate care sites during a surge. The link there, you can download the information on alternate care sites. They have adjusted the admission criteria slightly, but it's still a very limited intake criteria at the alternate care sites. In the handouts, I included what the intake form is for Sleep Train. I don't know if it for Fairview or Porterville, when the other sites are open, if the intake form is the same. But if you're interested in utilizing the alternate care sites as a decompression site, you want to review that intake form regardless of which one of the alternate care sites you're going to use, because there are very significant limitations to who they can take. So some of those are listed out in the AFL, but for more detailed information, I suggest you download the intake form, take a look at that, and that will give you an idea of how limited those alternate care sites will be for you to decompress folks to. Those limitations are going to be consistent across all the different alternate care sites. The primary reason for the alternate care site is to be a post-acute discharge. So people with COVID positive could go to the alternate care site rather than being sent to a specific facility. As facilities struggle with staffing issues, this may be incredibly important for the acute hospitals to have a location that they can discharge post-acute patients without impacting the skilled nursing facilities. And then decompression of your facility or an individual skilled nursing facility would be the last resort. In instances where we're having surge or large numbers of staff call off or large numbers of staff out on quarantine. Really the goal is to kind of support operations in place if possible. And we realize that the CalMat teams and the National Guard teams that have been going out may be, well, they are being drawn down, and some of those same people are used to support hospitals that are currently undergoing surge. So we may have to utilize this, but it's definitely as a last resort. And we want to make sure that you guys understand that both the state and CAF would like to see folks stay in their existing facility. There are complications that go with moving folks around, and we want to avoid that if we can. But if you run into a condition where you cannot staff your facility, then these alternate care sites are going to offer some ability to decompress. In areas in which you have identified COVID positive facilities, we would want you to utilize those resources first. So say Los Angeles County specifically, there's a bunch of facilities that take COVID positive residents, and they can take them from other skilled nursing facilities. There's a list of those on the public health website for Los Angeles County, and some other counties are doing that on a much smaller basis, but utilize those resources if you can. If you have partnerships with other facilities, whether it's a sister facility or a facility that's close to you, you can set up an MOU or a transfer agreement with those existing facilities. Because the 3-day wait or 3-day stay has been waived, you can do it a couple of different ways. You can discharge somebody to another SNF and have them admit them, or you can do it under a temporary arrangement. And we have examples of what they call memorandums of understanding. They're non-binding agreements that kind of dictate repayment terms if you're not going to discharge the person to that other facility. You could keep them as your resident, and you would pass along whatever payment it is, whoever the payer source is for that resident, directly to the receiving facility. So you have a couple different options there. I want to make sure that you're aware of all of those, but decompression to the alternate care site is probably going to be the last of those resources that you utilize. All right, with that, I want to ask Patty to just talk for a second about AFL 2089, and that's the requirements for application submissions for online and distance learning for the NATPs. Patty, can you give us just 30 seconds or maybe a minute or so?
Yeah, I'll give you the quick blurb. I haven't really, I used to be a DSD, I love DSD, so I plan to put out some stuff on the forum on this AFL because I am, you know, excited about it, but at the same time, I hope that they're timely in the process of it. The 160 required hours, the 100 hours of clinical still needs to be in an approved training site. The 60 hours can be completed through an online course, and they put out a process of what the training program, whether it's in-house in your facility or you have a contract with a school, what that program may have to do. So that's the short of it. And we're working on lots of ways to try to build workforce with CDPH. And part of that is we're going to be looking at CPR renewal, the CNA program, trying to cut through some of that red tape with that, trying to get California allowed temporary nursing assistants and so forth. We're working on a lot of things with workforce. So if you have any workforce ideas or you'd like us to elevate or creative ways to help California build workforce from feeding assistance on, just shoot me an email and we can add it to our conversations. Thank you, Jason.
Awesome. Thank you, Patty. Much appreciated. All right. So I want to jump to some fit testing information and let you guys know that I get on the CDPH calls and the HSAC calls and I'm asked to give very limited information, and really all I can do is talk about what the law is and what the regulations require. I can't say on those calls that I understand that you guys are in an unwinnable situation. And for many of you, despite all of your best efforts and every effort that you can give, you still cannot meet the intent of the law. I've made that very clear to the highest levels of CDPH, and so has CAF. It's important to know that we are actively trying to find ways to make sure that you guys are protected from this. But this has been a real testing issue for our relationship with CDPH. I think what's likely to come about as a result of this is we're going to see an AFL that's going to talk about the expectations and requirements laid out from CDPH. I'm working with one of the folks from the licensing to create the language that goes into the AFL. Expect in the AFL that CDPH is going to require all staff to go through the fit testing process. They're going to highlight resources in which you can obtain the fit testing equipment with a direct link to somebody that we can facilitate that. That was one of the things we asked for because we knew that the MOOCs are overwhelmed and they're not being very responsive. And we've got a lot of feedback that people are being declined or denied their request to get the fit testing equipment. So we will resolve that portion of it, but it's, I'm sorry, I did not finish this slide and it's a little bent over, but the very first link here, guys, is the important one. With the respiratory protection, I've given you guys a copy of the Model Respiratory Protection Program, and that's great if you want to employ that entire thing. You need to have a respiratory protection program. You don't need to use ours. You can use anyone you want to. The Minnesota Department of Health is fantastic, one of the best in the country in providing really concise documentation and guidance on how to do stuff. And so if you're looking for written procedures on a respiratory protection, something that's quick, short, down and dirty, that has all of the components you need, that link for the Minnesota Department of Health is very good. And I want to, even though I forgot to finish these bullet points, forgive me guys, I want to talk about just for a second what kind of workarounds that you guys should be quantifying. If you've not heard me say this, one, we have to have some kind of narrative documentation that talks about when we're searching, how often we're searching, and what the results of our search are to find a specific make, model, and size of respirator. I've told the state that if as soon as you change the size, then you have to repeat the entire process. The law is not congruent with us having really stretched resources for that. And outside of waiving the law or having them release some kind of information that says it's okay to just obtain a seal or okay to waive that portion of it, you guys are going to be in the crosshairs from a regulatory side. And it makes me sick to my stomach to think about that. But yeah,
Jason,
go ahead. Yeah.
I was going to jump in because right there is a perfect opening. We are seeing a lot more IJs and intents to cite regarding fit testing. So it is really important that you look at your practices right now on what you're doing fit testing. Although the CDPH surveyors have not made it an issue on mitigation plan approvals, facilities that had nothing in there regarding the fit testing or a plan, or on their infection control surveys or mitigation surveys. This has not come up. And it's just coming up now. They're focusing on it. I was on the ACA regulatory committee call a couple days ago, and they're getting across the state. There's been a lot more IJs issued regarding fit testing and just infection control practices in general. Yeah. You really have to show your good faith efforts. So before they issue you an IJ, and if you feel like they're looking at something on your infection control, get them an action plan to those surveyors immediately that you've identified what they're looking at right away. They won't be able to call your IJ because you've already lifted your own immediacy. Now, you might still get high scope and severity, but you still won't go into the IJ process, which is, very stressful on your facility. So create action plans now. If you know you have a weak area in fit testing, regardless of the reason, write an action plan now. that you can hand any surveyor that walks into the facility and identifies that issue. And this is your action plan for that issue, and show them all your good faith efforts.
Yeah, thanks, Patty. That's perfect. That's she's not kidding. I get the calls just like she does. There's a lot of folks that are getting these citations. So definitely, I can't stress this enough. We realize it's a real area of concern. You could be compliant this month, and then next month you get a different shipment of masks, and now you're no longer compliant, and then you have to refit test every single person. It's incredibly difficult to obtain, a specific make and model mask. So this has become a big operational concern for most facilities. My hope is that not only is CDPH going to release the AFL, which we know they're going to do, but it's going to come with some training that we'll be able to point folks to. Our sister or our partners in Arizona have developed a program, a train the trainer program. My hope is I can have the chief of that department in Arizona come over and give us a presentation. If folks are interested and if there's a cost associated to it, please indicate in the chat box or in the question section if you felt like you would be willing to pay for a service, if I had to pay somebody to come do it, or each person had to pay. Please indicate whether that's something that would interest you, and I can flesh that out. Maybe it's CAF that pays for it for each person. I don't know how expensive it is, but we might be able to get somebody to do it if you guys are interested in that. So definitely indicate your interest over on in the question section. All right, so we've got a bunch of questions about vaccine. And I want to just kind of talk about what we know from a state side, and then I'll get into the Los Angeles thing in a second here. So we do know that all staff and residents are still considered in Tier 1A. That priority has not changed. How that distribution is going to come out is going to look differently than maybe well, let's put it this way. There's going to be, in most counties, there's going to be two kind of distribution methods. And one is going to be for us through the pharmacy program, and the other is going to be for everybody else. Kind of the example would be acute care hospitals are going to get shipments, let's say 5,000 doses, and they're going to get 5,000 doses. And those 5,000 doses are going to be for the healthcare workers in their individual communities, first responders that are at high risk, things like that. Those folks are all going to be working with those acutes to secure the vaccine. The acutes are going to work with those smaller providers to divide up the shipments, because the shipments for the Pfizer vaccine come in allotments of 975. And obviously, there's big, huge storage concerns, very little time outside of the frozen storage that it lasts. So that's the way the remainder of the counties are going to do it. And the plan is to have the pharmacy partnership program to vaccinate both staff and residents. That's not unexpected. This is a continuation of the message that we've been receiving from CDPH. I will say that both CAF and just about every professional association in California is at the table with these vaccine delivery work groups, and everybody wants to be first. Everybody wants to be first, or they want to fight to be first in the Tier 2. There's a lot going on that if the pharmacy partnership program works, we'll kind of will avoid a lot of that information or a lot of that kind of flack. There is sub-prioritization still going on, and that's being done at a county level, and the counties are doing that division up. It's still true that the state has received an initial allotment of 327,000. That has to be divided up into, at least 2 million folks in the Tier 1A thing. And from what I've been told is that the acute care hospitals have their first distribution on hand now. and they're expecting to get 1.5 to 2 times that initial distribution in the second distribution, and they're expecting distribution of the Moderna vaccine beginning the 21st, and they will begin to incorporate the Moderna vaccine into their planning, and it's more likely that they're going to use the Moderna vaccine to supply those other folks in Tier 1A that may not have a need for quite so many doses at their individual site. So we talked about how is the vaccine going to get to me, and that's the pharmacy partnership program for both staff and residents. We understand that that's the case for the remainder of California outside of Los Angeles County. In Los Angeles County, it's going to look like, well, the local health department is going to facilitate the dispersion of the vaccine. It's unclear to me if the local health department or Los Angeles County Public Health Department is going to store the vaccine, since they're talking about the Moderna vaccine for the long-term care facilities. There's a much less restrictive storage requirements. So we're unclear if the GAC or the acute care hospitals will store those, or whether the local health department is going to store it and then distribute it. The SNFs are going to be closed pods, meaning you're going to do the point of dispensing within your facility, but it's only going to be for your facility staff and residents. You're not going to be doing vaccine clinics for the remainder of the public. All right. So vaccine, Pfizer, if you hadn't heard, Pfizer obtained their approval yesterday. So what I'm going to talk about here does not apply to Los Angeles County. So please, if you're in LA, bear with us. We'll get to that in a second. Walgreens is still in the process of contacting every facility. And I realize that the communication, at least that I've heard from Walgreens, has been less than it has been with CVS. So if you're a partner with CVS, you should have received an email that was sent out to each facility that asked you to update contact information, and it provided a website with COVID-19 vaccine resources for you guys to take a look at. The good news is, under this program, a physician order will not be required, and that came from the American Healthcare Association. Dr. Gifford, Dave Gifford gave us that information last night. And the Health and Human Service Secretary has waived the PrEP Act so that the pharmacist can order and administer the vaccine. We did hear that staff incentives are allowed. So if you're thinking about a creative way to engage your staff or to overcome some of the vaccine hesitancy, if you think incentives are an appropriate kind of motivational tool, you certainly can use that. Some of the feedback I got from folks at CDC when I broached that subject, where they thought it was a good idea, generally they frown on incentivizing the taking of vaccines because they think it sets a bad precedent. And I'm not so sure about that. And but I leave that up to you guys to determine. I just want to let you know that there is flexibility to allow you to do that, and we confirmed that with CMS. All right. We have some promotional material that Pfizer released, and it's the nuts and bolts of the information. If you're a geek or you want to read all the information on the Pfizer material, and you're on the phone and you want to, take a look at that, you can just Google the Pfizer promotional material for the COVID-19 vaccine, and you can download the PDF. The great news, fantastic news, is it's shown to be very effective in older adults. So for our residents, this is fantastic news. The most common side effects from the announcement that Pfizer put out from the FDA submission, about 85% of the people or even higher had injection site reactions. I don't think that's uncommon. Redness, swelling, soreness around the injection site. Every time I get a flu shot, my arm's sore, so that makes sense. In much smaller cases, there are systemic reactions which cause fever, headache, or general malaise. There are adverse events causing withdrawal from the trial. So there are some adverse events. Oddly enough, what I found strange was the adverse events were higher in the placebo group than they were in the control group. So if there are significant adverse events, they did not display during the trial. And we talked about the size of the trial and how much larger it is than a traditional or the minimum recommendation. So that's all great news that we can avoid some very serious side effects with this. And I put a quote here from Dr. Gifford, who said that that this particular vaccine appears to be very safe with predictable reactions. Great news for us, all that good stuff. So I quoted extensively from Dr. Gifford's presentation, and I want to make this available to you guys. That ACA AHCA did a webinar yesterday on the vaccine clinics, and it has a ton of great information. So if you click that link and you go, even if you're not an AHCA member, I believe this is open to members and non-members, but you will have to click on the link. And then if you're not a member and you don't have a sign up login, you'll have to create a registration, and then you can view the webinar. There's a number of resources there, especially in terms of what you can give to family members, talking points for talking to your staff about vaccine hesitancy. Patty, what were the other handouts on there? Because there was one on tracking, and we talked about it this morning. What were the other handouts on there that they?
I think there was the tracking, like the flow sheet to put in your MAR to track for side effects. I think there might be stuff for care plan. There's a lot of great tools, typical tools that we use for a normal vaccine, and they've added them in there.
All right, fantastic. So I recommend that at some point after this webinar, you definitely take a look at that. If you're not in Los Angeles County, you want to watch the webinar, download the links for sure. All right, so let's get to Los Angeles County. Many of you guys had received notification from Los Angeles yesterday that Los Angeles was going to pull out of the pharmacy partnership program, and they were going to facilitate the vaccine delivery for all Los Angeles, or all Angelinos, not just the folks in the skilled nursing facilities. They had a multitude of reasons. Some of them were very. They had concerns with the pharmacy program, just like we do, and I think they felt that they could better control vaccine delivery and performance and consistency by doing it themselves. Well, that's yet to be seen. We would have liked earlier information, and we certainly could have given them feedback. Many of you have spent weeks planning, reaching out to CVS or Walgreens and fleshing out your plans and how you're going to do this. All of those are going to have to be put to the side. Now, if you're in Burbank, or not Burbank, if you're in Pasadena or Long Beach, we've still not got confirmation. The county had originally said it was going to be for everybody in the county, and then in that note they sent out, they said, well, we don't know about Pasadena or Long Beach yet. Long Beach reached out to a provider and said, we're definitely staying in the pharmacy partnership program. So for those two specific cities that have your own health departments, I'm not certain, but when we find that information out, we'll post it on the CAF forum. Like I said, we had issues with the lack of information and transparency, and we certainly think we would have been better prepared, and the county would have been better prepared had they engaged us earlier, and we could have talked about some of these operational issues.
Jason?
Yeah, for sure.
You may have it in an additional slide, but I just want to make sure we cover that. There's a deadline to even for the LA stuff there. You got to register on their site by the 14th. And then also there'll be another registration additional registration on top of that for your vaccine reporting, which could take could be a timely issue. So I just wanted to cover that.
Yeah, for sure. And I think I have that in either the next slide or one of the next ones, but definitely.
Oh, great. Sorry.
No, that's okay. We've got a really finite time, guys, to get this done. You're going to have a lot of work between now and the 14th. And I just want to cover some of the highlights. So in LA County, the plan is that you will be shipped a Moderna vaccine and not the Pfizer vaccine. The Moderna vaccine itself has similar efficacy, performance, and safety. I haven't seen the EUA submission yet, but I have talked to Tal Zaks, the Chief Medical Officer for Moderna, and I've gone over all of these issues with them. I'm really confident that the EUA submission that Moderna submitted is very, very similar to Pfizer. The efficacy is slightly higher, the performance is slightly higher, the safety is slightly better. So in terms of performance of the vaccine, we're talking, real small percentages of difference, but they're really, really close. The differences for us are they're much easier to store. So if you're storing the Moderna vaccine on site, you can store it in normal refrigeration for up to 30 days. If you're going to store it for more than 30 days, it needs to be at -20 degrees. And there's a link to the Moderna announcement, which talks about the storage requirements for the vaccine. As you look at this, and the doses come in a multi-use vial. Each vial contains 10 doses. So if you think about, if you had 200 staff, that's 20, or 200 staff and residents, that's 20 of those little vials that you'll have to store. Not a huge amount, but it is something you need to consider if you don't have that type of refrigeration and you plan on storing more than 30 days worth. It's got to be done in a freezer. All right. Well, we talked about ship to the facility. What the operational problems this is going to propose for you guys is you are going to be doing the vaccine delivery, storage, and reporting all yourself. There's a COVID ready requirement that you sign up on COVID ready to be able to receive this vaccine. So if you've not done that, you have to do it. It's a mandatory thing you've got to do. You got to sign up with COVID ready. Now for right now, I'm just going to say that if you're a SNF, go ahead and sign up on COVID ready. If you're an ICF provider or you represent a CCRC where you have multiple levels of care, we will find out about those other folks, but for right now, the SNFs, 100%, you all have to sign up on COVID ready to be in the vaccine program. And there's 3 handouts included with today, before you know, a quick start guide and enrollment instructions in Cal Ready, or COVID Ready. I know that there are questions on the COVID Ready questionnaire that talks about your cold chain storage and things like that. We don't have to worry about that because we're not going to be a part of the Pfizer distribution. So however you can get through those questions, whether you answer them yes or no, it's not the material thing. And what LA is really, really concerned about is making sure we have the appropriate numbers and the appropriate contacts at each facility to be able to set up the distribution and shipment. There are big benefits and there are big drawbacks. Well, we talked about some of the drawbacks for sure. One of those is the reporting requirements. Forgive me. An helicopter flying over my head. So there's the link to enroll in the California Immunization Registry, careweb.org. So you go sign up on CareWeb. If you've not already signed up, everybody has to be signed up that's going to be doing vaccines. So, hey, Patty, in your estimation, do you think most or some of the facilities have already done this? And if they are they familiar with the process?
I'm not, I don't really have much information on that.
Yeah. So
no, I don't think so.
Yeah, and this is one of the things that we've just not done before, really, in any depth. So it's probably going to be a long process. but the link is there for you guys to go get signed up. And there's the link to the COVID Ready sign up. If you have access to the slides, you just click on that and it'll take you to the COVID Ready sign up. All right, I want to talk for a second about the benefits, just so you guys know why LA decided to do this. Even though they made no, well, they had limited engagement with CAF, they had been in conversations with different providers, and a lot of the providers, many of the providers, including us, have real serious concerns about doing a vaccine clinic all in one day. And with the numbers, you know, somewhere between 0 and 10% expected to have moderate symptoms that could cause them to miss work, we have concerns about doing a clinic and all in one day. And so that was kind of one of the driving factors between why LA County wanted to do this. The second thing is they've not had great response from the CVS and Walgreens partners in terms of ideas of what the distribution is going to look like, when it's going to come, are they going to have enough staff to be able to shipment? So when LA posed those very detailed questions to both our state and federal partners, they did not get a response, or one that was sufficient enough to ensure that our folks are going to be included in the Tier 1 distribution in a timely manner. So they decided at the last minute that they were going to change their mind. The benefit to us or to you guys is, one, we're not going to have a required signed consent form. So that CVS and Walgreens consent form that everybody else is concerned about, you no longer have that on your plate. You will be able to vaccinate on your schedule, and so you could theoretically spread it out to you know, determine whether you're going to have operational problems with those vaccine side effects. I asked Dr. Rubin last night if providers could engage their existing long-term pharmacy partner to assist if needed. And we had a member talk about, well, gosh, what if I take delivery and I have my long-term care pharmacy stored and administer it? And Dr. Rubin was open to that possibility, and that's something we'll be fleshing out. And that could really, really help you guys in terms of the operational side of running, you know, the administration of the vaccine. I'm not certain that will relieve you of the reporting requirements. I don't think that long-term care pharmacies could do that for you as well. So I think you got to at least plan to make sure that you're in that the immunization registry, even if you're planning on using your long-term care pharmacy to help you administer the vaccine. The plan is in Los Angeles County that beginning the 21st, the Moderna vaccines will begin shipping out to you, and you'll be able to store this on site. The other benefit is that as you hire new staff, as you get new residents, as they come in, you could have vaccine on site to be able to do the vaccination yourself. So what are the drawbacks? A lot of unknowns. A lot of unknowns in terms of, you know, the planning work we've done. The operational work is now all going to be on your shoulders. And not only is the operational work going to be on your shoulders, but the responsibility for seeing the vaccine is widely accepted in your facility, as well as the work is actually done. And so a lot of times when, you know, the government sends us stuff, there's an expectation from the public. There's a message that's going to be told on how quickly we can do this. And now that has put you guys to the test. And just know that if you struggle with this, this could become a public relations issue. So we want you know, all your focus to be on this, especially as it relates to you know, media messaging or media getting a hold of information that you're not doing the vaccines as quickly as you should, or things like that. There's an unbelievable appetite in the media right now for seeing how this vaccine rolls out in facilities. And any little problem, you can expect folks to attack it like there are sharks and there's blood in the water. So expect a lot of focus from the media on how we perform.
And
LA
Jason,
has, yeah.
And when we're looking at that sort of thing for the immunization without the pharmacy involvement, I went in conversations with CDPH prior to even this announcement, for the regulatory process and for the liability process, we have to follow our normal regulatory process that we would for any vaccine. So we've done flu vaccines year after year, all the other required immunization vaccines that are required to offer to our employees. And in conversations with CDPH, they have just restated over and over again, follow your normal facility process. Now, if Walgreens or CVS were doing it for you, of course, there's a little differences there. They're going to have their own consent forms and they're going to administer it. But if you're administering your own vaccines in LA County, the additional layer is set up your billing process to make sure that's normal, how you would for your influenza vaccines, for you can bill for the administration of these vaccines themselves.
So there will be a survey that comes out from Los Angeles County, and the survey is going to be very brief. It's going to ask, what do it's a self-assessment of what do you think your capacity is to be able to do all of this on your own. If you feel like you need help or you're going to need support, LA has committed to hiring outside contractors to support the operations of having vaccine clinics similar to what CVS and Walgreens would have been doing if needed. But you've got to answer on that survey. If nobody answers the survey that they need help, they're not going to hire these folks to do that. So as many people that get on that survey that need help, you need to identify that, yes, I'm going to need assistance so that we can give them an appropriate number of how many teams that they're going to need to onboard to be able to support that. And then, like I said, education's going to follow. Hopefully you will be able to have one person or multiple people participate in this webinar. Here's the direct link. I put it out on the CAF forum earlier, but it's going to be directly after this. So 15 minutes from now, this will start. And I'll be on the webinar. I'm not a presenter. I'm just going to be a participant like you guys. So we'll all learn at the same time. I can't say I'm sorry enough. We had no idea, guys. Had we known, we would have helped inform some of the planning decisions they made, and we would have been more transparent about this beforehand. Before I get off that, I just want to, guys, if you guys are ready to just pull your hair out, I think there are some real big benefits to folks in Los Angeles County as a result of this, especially in terms of being able to schedule your own vaccines around whatever's convenient for you. I think that can be a huge win, not just for you, but for the residents too. And I just think we've got to make lemons out of lemonade, or lemonade out of lemons. And that's the condition we're at now. How do we make the best of it? And so watch the LA webinar and let us know if you have any questions. As soon as we hear any information, we'll pass that along. I just wanted to keep one slide in here for the sources of information to let you know that some of those conversations that you should be having with your staff about vaccine hesitancy and stuff like that. There are a lot of great things developed. I'd say, ask questions of your staff, find out what they're concerned about. Is there data that they need to sway them? Or are they a hardcore anti-vaxxer and you're never going to talk them out of it? And that's okay. We just have to make do with what we've got. I can't change people's preconceptions, but what we can do is we can give them the best information that we have. So with these particular vaccines, they happen to be incredibly efficacious, and especially for the folks in our buildings. So that's all great news. All right, so I want to say thank you. I'm going to try to get to a few questions, and then we're going to get out of here really as quickly as possible, because I know folks need to get on that LA County webinar. So I'm going to start at the beginning here, so bear with me here. We've got a lot of questions. If there is an outbreak in a nursing facility and the insurance gave a last cover day and a discharge date for this patient to discharge back to the community, does that mean that due to this AFL, we can keep the patient longer and insurance will cover? Ooh, gosh, I don't know the answer to that one. I would say if they're supposed to be discharged and they're COVID positive, gosh, I wouldn't want them in my building anyways. And if they're healthy enough to go back home, they could quarantine at home. Patty or Deanne, do you have any other insight into that, or do you think, or would we have to get more information to be able to answer that question?
Well, this is Deanne. If the person is safe to go home and just has a diagnosis of COVID, then you would follow your normal discharge plan. So if they chose to say they're not okay to go home and they didn't feel safe, then you would need to revisit that care plan. But if their plan is to go home, they feel ready and capable, and your assessment is they're safe, then even if they are positive for COVID, then you could move forward. I would just give them lots of support and follow-up to ensure that they remain safe and don't decompensate once they do go home. So just make sure they're safe in their home.
Patty, we've got a question here that says, any comments on out-of-state surveyors or CMS contractors doing focused infection control surveys? Had you heard that, Patty?
No, I haven't heard that yet. I can reach out to CDPH and ask if anything like that's going on. I haven't heard. If anybody has heard of that going on, shoot me an email at pons@caf.org, and so I can know where it's going on or what's happening, and we can look into that a little bit more.
Yeah. All right. And so the next question is, physician order requirement has been waived. How about written consent and verbal consent for the vaccine? And I'm going to assume you're not in the Los Angeles area. In the Los Angeles area, because they opted out of the pharmacy partnership program, our assumption is that a physician order will be required in those for Los Angeles County. Patty, do you are we pretty confident that we think the physician order will now be required in Los Angeles?
Let me jump. Yeah, I'll jump in on this, Jason. So for LA, we'll follow our typical process. So if a nurse in your facility is going to administer a vaccine, then you need a physician order for the residents. For the staff, you follow your normal policy and procedure that you would for influenza or any other vaccine. This will be a good time to pull out your policies, your vaccine policies for your resident and for your employees, and take a look at them, make sure they are, you know how to follow them. And so for LA County, you'll be administering your own vaccines unless they do a clinic and that they figure out that they're going to administer them, then that would be a whole different thing. We don't know right now. Right now they're saying they're going to distribute them and you're going to do them. For consents form, remember, this isn't an informed consent. It's your normal consent process for any vaccine. And again, this is for LA County. I'm not talking about people with the pharmacy program. If your responsible party is in another state, your regular consent can be over the telephone. You verify it with whatever your policy is, 1 or 2 nurses that they gave a phone consent, or you have a form, then the nurse would sign that form and they could verify the consent was given. For the unrepresentative resident in LA County, you follow your normal process for unrepresented residents that you would for any immunization, just like you normally would, because it's not informed consent. It's not going to be affected by the new law for EPO because it's not informed consent. Now for the pharmacy program, your consents for that are going to be covered by Walgreens, and there's no official consents, but you know, we usually document in our own resident charts. I recommend keeping a copy of that Walgreens consent form for your employee and your resident, and do retain them in your records. And then for the orders, they say there is no order required because the pharmacy will be doing the orders and in the consent forms. I think that covers that, Jason.
No, that's perfect. Thank you, Patty. I would have butchered that, so that's great. All right, the next question is LA County authorized to remove all SNFs from the federal pharmacy program? And what we've been told is the state, chooses to opt in or out of the federal pharmacy program, and they have not done so yet. I've asked the chief over at CDPH if they've opted into the pharmacy program yet, and I think that's a part of why LA County moved, is because CDPH has not chosen to activate the pharmacy partnership program yet, and that's a concern when we're a few days away from having a vaccine. So yes, they can submit whatever plan they want to CDPH. CDPH could choose to say, no, we want you to stay in the pharmacy partnership program, but I'm under the assumption that this is what we're going to do, and we've just got to take actions that this is the process we're going to fall under for Los Angeles County. Next question: do we need to sign up for both COVID Ready and California Immunization Registry? Yes, if you're in Los Angeles County, absolutely.
And Jason, on the back question, real quick. This is Patty. CDPH, I want to make clear, as of yesterday, when we notified CDPH what LA did, they were not aware. So I'm sure right now there's a lot of back work going on right now, making decisions on what they're doing about what LA County did. Are they going to turn on the program for California? What are other counties doing? That sort of thing. So I'm sure over the next few days, this will be a really hot topic that will be coming out fast and furious.
Yeah. Perfect. Thanks, Patty. All right, we've got we're gonna go for 2 more minutes, guys, and then we're gonna jump off so I can get on the LA County one. All right. So a couple of people have said there's a password for Los Angeles vaccine webinar. Let me. I'll see if I can find information that I'll put it in the forum real quick here, guys. And a couple of people had indicated, Patty, that they had received a federal survey through a contractor, and they're sending me the information, so I'll pass it to you. All right, how do we go about requesting additional staff during a COVID outbreak? And let's end on that one. So there's a process through the MOOC that you would request staffing resources. That process is a process of last resort. So meaning when you go to ask them for staffing help, they're going to confirm that you have explored and exhausted all of your internal resources to secure extra staff. So the things that you want to quantify or list out that you've already accomplished or you've already gone through before you ask for staff is you want to say, I did staff call-ins, I adjusted staff schedules to stretch the staff where I could. I contacted the registry. I contacted my sister facilities if you're a part of a chain. List all of those things, all the methods you went through to get staff and you were unable to get it. Then through the MOOC process, you want to say, I need specific type of staff. I need 2 licensed nurses and I need 6 CNAs. I need 1 nurse on the NOC shift. I need 2 CNAs on the day shift. You have to be as specific as possible. What I want you to do, if you're not getting responses back to that request, and when I say responses, if you're not getting quick responses back to your request, let me know immediately so that I can get involved. I'm on calls and phone calls all day long, but if you are at the process where you're almost getting ready to evacuate because you have no staff, definitely get me involved. And if I get involved, I will make calls to the folks who can make things happen. But if I don't get that notification from you guys, we can't assist. So you got to let us know when that happens. There has to be a flow of information up from you guys to us. There is an AFL that just talks about the process of requesting, staffing and stuff like that. all of that information is listed out in that AFL. My suggestion is to, review the AFL if you have any questions about that. Let me give you the AFL number here. Well, I'll have to find it and post it on thing, but there's an AFL that talks about the exact process you have to do it. So I want to say thank you guys. I know this was a bit rushed. We will have much more information on the vaccine as it rolls out. I want to say thank you. Hopefully you enjoy this weekend. We've got a lot of work next week to get prepared for this vaccine delivery. So take care. We'll talk to you soon. Thanks very much.